I am a public health researcher and I am the coordinator of the Zika Social Science Network. We are working in a big national, international networking about social science, humanities and Zika research. And we are starting a very important cooperation with UK institutions, and we would like to strengthen recommendations how to face the Zika outbreak and its repercussions in our country, in Brazil especially. And for us, Zika is not over. Social consequences and public health consequences, it's still working. Yes, social movements is really important. In Brazil, our national health system included as a principle social participation in different levels of the country. So in the federal level, in the state level, in the municipalities. So we stimulate social participation and social movements to engage to social policies, to health policies. So this is very important and crucial in the times of epidemics. So after the Zika outbreak, disabled children especially became invisible to our authorities. But now, when Zika epidemic is over, so they getting invisible again. So we have to stimulate and to talk with the authorities, and social movements are especially important and crucial in these policies. Well, one of them, I think that's it. It's how to involve public communities, participants since the beginning. The other is how to communicate prevention behavior, his communication to the society. One important thing during the Zika outbreak is to create a big enemy, the mosquitoes. No, the mosquitoes is also important. To create vector control initiatives is also important. But to face inequalities, how to improve sanitation, clean water, living conditions all over the country, and especially developing countries. So we have to think more broadly about these issues. So it's not just about a known vector or on virus, but also how to think more broadly and to think on intersectoral policies. So this is an important thing. And also interdisciplinarity. So it is also important to improve science in a more fair way. Brazil became a big laboratory for national scientists and international scientists. So we had a kind of overcharged about these families, and they need, and they are the scientists are responsible to give a follow-up to the families and how to involve families and society since the beginning in research protocols. I think that it's another important challenge to face during, after outbreaks, but especially after, to have a kind of preparedness to the next outbreaks. Because we are, during the outbreaks, we have a kind of exception about rules and ethical procedures. So we have to defend these families, the participants and the researchers especially. So these movements are very important in how to respect, to give them respect that they really need. Because sometimes we receive, just for example, informed consent in a Brazilian, to Brazilian participants and to the families in English, and also in Mandarin, for instance. So we are in a very unequal country. So they need respect for science and international community. So I think that one big challenge is how, again, to involve participants and family affected by Zika since the beginning, building together protocols, research protocols, even in clinical studies, social studies, and biomedical studies.